So good afternoon, everyone. Saturday briefing, and I am just going to begin by turning it over to Dr. Morrison to begin. So.
Good afternoon. Today I have two new unrelated cases of COVID-19 to report in Prince Edward Island. The first is a male student who attends Charlottetown Rural High School. The positive test result was confirmed this morning. The student is at home isolating and has mild symptoms. All close contacts of the student are being contacted by public health to arrange for testing and inform them whether they need to self-isolate. They will need to self-isolate until their test results come back at least, and some of them may need to isolate at home for 14 days. This student did travel to school by bus on November 25th and November 26th. Those students who travel on these buses will be called as well and told to get tested. Any student who sits within 6 feet of the student will be considered a close contact and will be contacted by public health and again told to self-isolate for 14 days because they're close contacts. The bus numbers are number 3 and 23 to school and 23 home from school. Out of an abundance of caution, all staff at Charlottetown Rural High School are being asked to get tested. Students and staff who need to be tested should remain in isolation and not return to school until they receive a negative result. And everyone who is getting tested should isolate, keeping as much physical distance from others in their household to the best of their ability until they receive a negative test result. Individuals who are told to be tested should go to either Charlottetown Testing Clinic on Park Street here in Charlottetown or the Slemon Park Testing Clinic in Summerside today. The clinics will have additional staff on today and will be open from 12 to 8 p.m. Please be patient with the Health PI and Island EMS staff at the testing clinics. They will be working as fast as they can to get everyone tested. We are working closely with the Public Schools branch and the administration at Charlottetown Rural to help manage this situation. There are also 2 public exposure locations related to this case. Wendy's Restaurant, located at 634 University Avenue in Charlottetown on both Wednesday, November 25th and Thursday, November 26th from 11:30 until 1 o'clock on both days. And the Needs Convenience Store at 259 St. Peter's Road in Charlottetown on Thursday, November 26th from 9:30 to 11 p.m. Anyone who is at these establishments during these times should closely monitor for symptoms, and if symptoms develop, get tested and isolate until they receive their test results. This case also plays hockey with the Sherwood Minor Hockey Midget A Central Team number 2. All close contacts of this individual, such as teammates and coaching staff, will be contacted by public health to arrange for testing and be given direction for self-isolation for 14 days. Any other individuals who require testing in relation to hockey-related activities will be called by public health. And I will share more information about this situation as our contact tracing and testing and investigation continue. The second positive case is a male between 10 and 19 years of age who arrived in the province following travel outside Atlantic Canada. He has been self-isolating since arriving in Prince Edward Island. I did speak with him last evening. He is doing well and will remain in isolation at home. I want to clarify that he is not a student in Prince Edward Island. All of his close contacts have been called and are also self-isolating. He flew to Prince Edward Island on Thursday, November 26th on Air Canada flight AC 7462 from Toronto to Charlottetown. We have notified the airline, and out of an abundance of caution, anyone who is on this flight should closely monitor for symptoms of COVID-19, and if symptoms develop, get tested and isolate until they receive their test results. I can appreciate that this news is concerning and overwhelming for students, parents, and our school community. And I know this is not the news parents want to hear. It is important that individuals who are contacted by public health nursing follow the guidance that they are given to get tested and isolate until they get the results. This is also a time for all of us, as parents, teachers, and community leaders, to work together to support our children, students, staff, and each other. And it is the time for us to pull together as an island community to support one another. I am again urging islanders to keep their social circles small and practice the public health measures we have in place to keep us all safe. Wearing a non-medical mask, physically distance, wash your hands regularly, stay home if feeling unwell, and most importantly, go get tested if experiencing symptoms of COVID-19. We do want to be able to continue to go to restaurants and our children to attend school, to attend church. We want our businesses to remain open and for our economy to continue to function. As I say every time, let us continue to be patient and kind. Thank you, and I think we'll open it up for questions.
I just wanted to just add, Dr. Morrison, I didn't do it at the beginning, but we do have Norbert Carpenter from the Public Schools branch here as well. If any of our friends in the media have some logistical questions about the school itself or the operational plans, et cetera, that are in place, Norbert will also help answer some questions that we might have. So with that, I would turn it over to our friends in the media for any of their questions.
Mike Robar, The Guardian.
Good afternoon, everyone. I'm wondering first if you know how the Charlottetown rural student may have come into contact with COVID-19 to begin with.
Hi. So that is still under investigation, and we're exploring, and that's part of the contact tracing, so we're not sure at this point in time, but we certainly would not want to wait and not get everyone tested in the school and other exposures until that investigation is complete. So we'll certainly keep people informed as we find out more.
And I understand this seems like a bit of a bigger case than the one earlier this week as far as contact tracing goes. Do you have any idea of how long that might take?
Well, I'm hoping that we'll be able to test the additional, we anticipate a couple of hundred, at least 2 or 3 extra 100 tests that will be done. And if we can get them done today, those results are hopefully available tomorrow.
Thank you.
You're welcome.
Laurent Rigaud, La Voix.
Bonjour, Dr Morrison. Est-ce que vous pouvez réexpliquer brièvement en français tout ce que vous avez dit, s'il vous plaît?
Je vais quand même essayer. Bonjour Laurent. On annonce 2 cas de COVID-19 ici à l'île du Prince-Édouard aujourd'hui. En premier, c'est un étudiant à l'école Charlottetown Rural et puis il est chez lui et il isole maintenant chez lui. Et puis, on est en train d'avoir les listes de ses classes. Et puis, la liste, il prend aussi l'autobus. Et puis, on reçoit la liste de ses contacts. Et puis, on veut que toutes ces personnes aient un test pour le COVID-19. Et puis, après le test, qu'ils restent chez eux. Jusqu'au moment qu'il reçoit un test négatif. Les contacts qui s'assoient proches de lui, ses amis, les personnes à côté de lui sur l'autobus, ces personnes seront aussi contactées par Santé publique et puis ils vont, même si leurs tests sont négatifs, ils vont rester en isolement pour 14 jours. Et puis, les personnes qui travaillent à Charlottetown Rural vont aussi être testées. Et on a un autre cas, c'est pas relié, c'est pas, mais on annonce un autre contact, un autre cas entre quelqu'un qui a entre 10 et 19 ans, Et puis, il arrive hors de la région atlantique et puis il isole chez lui à ce moment.
Et juste un follow-up sur ça. Enfin, vous avez dit que tous les contacts de l'élève seront testés, toutes les personnes qui étaient dans les bus, l'équipe de hockey. Combien de personnes ça représente? Combien de tests vous devez effectuer aujourd'hui et dans les jours qui viennent?
C'est difficile, j'ai pas le nombre. On est en train de vraiment avoir la liste vraiment jusqu'à quand, depuis le moment que je rentre ici, alors on reçoit les listes, mais j'imagine que ça va être 200-300 en total.
Merci beaucoup.
Travis Kingdon, CBC.
Hi, thanks for taking our questions. Question for maybe Dr. Morrison or potentially Norbert Carpenter there. Curious about the protocol involved with this test and the decision to kind of keep the school open.
Do you want?
It's Saturday.
Yeah.
Thanks for the question and good afternoon. We haven't made any decisions about the school, whether it be open or not. There's lots of work to do, obviously, and we work in conjunction with CPHO. So at this point, we're not making a statement about whether Charlottetown Rural would be open or closed on Monday.
What kind of things would you look at for making that decision?
So we've been planning for situations like this. We've had tabletop exercises and have numerous contingency plans, but it all boils down to safety. Of course, there has to be some cleaning and disinfecting of the school, but the contact tracing has to happen first, and CPHO has to finish their work. And so it will be a decision that we make as we go forward in the next number of hours. But there's lots of things. It's student safety and staff safety, of course. So we need to be very certain that that can be maintained before we make any decisions.
And Travis, I would just add to that obviously throughout our response to COVID, we've always erred on the side of caution. We will continue to do that. We just feel if there's one benefit, and there doesn't seem like there's ever much benefit in this, but the fact that this is happening on a Saturday, nobody is in school right now. And as Dr. Morrison has been articulating with her statement, and to me personally this morning, let's see what the next 24 to 36 to 48 hours brings, and we will let the epidemiology and the results of the testing determine where we're at. And I think we've demonstrated throughout this that if we need to make decisions in the interest of safety, we will make them. But we just feel it's premature right now to make a decision about Monday when we're still trying to get through Saturday afternoon.
Rose St. Pierre, Radio Canada.
Oui, bonjour. Ma question est pour Dr. Morrison. J'aimerais vous entendre en français sur les causes de contamination pour l'étudiant de Charlottetown Rural High School.
Bonjour Rose, j'ai pas compris. Vous voulez comprendre les rôles?
Comment est-ce que cet étudiant de Charlottetown aurait pu attraper la COVID?
OK, je m'excuse. On ne sait pas encore. C'est un cas isolé à ce moment et c'est sous investigation, vraiment. Alors, on va voir et essayer de trouver la source, mais à ce moment, on ne sait pas.
Est-ce que vous craignez une contamination communautaire?
Vraiment, à ce moment, je ne sais pas. C'est très tôt. On voulait très, très rapidement commencer de faire les tests, de faire les contacts, les personnes qui étaient à la possibilité d'être exposées. Alors, on a beaucoup de travail depuis vraiment juste quelques heures et puis on va continuer. Alors, on ne sait pas à ce moment.
Merci.
Okay, merci.
Ken Linton, CBC.
For Have there been any discussions internally about any of the schools, how quickly you could pivot to online learning, and if there would be any conversations about closing a school down early for Christmas break?
So the first part of your question, the answer would be yes. So many conversations about that and all kinds of situations, whether it would be the closure of a single class, a cohort, an entire school, and how we would pivot to remote learning. And it all depends on the availability of the staff member. So if a teacher is implicated and needs to stay home, then that's a different situation that we would have a plan for, and we do. If the teacher is well and is at school, then that looks different for that teacher delivering lessons to the students. So we have plans for all of that. We have not had conversations. I mean, we've had conversations, but there's no plan to alter the school calendar before or after Christmas.
I think Premier wanted to finish.
Yeah, I just really, I wanted to just, as a closing, echo what Dr. Morrison said in her initial statement, that I know that this news is concerning for Islanders, but I also would like to remind Islanders that although we have enjoyed a lower case count as compared to other jurisdictions, we have been in situations such as this one before, in particular earlier in the summer with the situation of the case of a staff member in a long-term care facility, and also the situation of a healthcare worker at our emergency department at the QEH earlier this summer. And I know that the news of this most recent case and the fact that it involves a student at one of our schools for the first time is certainly concerning initially to hear. I know it was for me, and I think for Dr. Morrison and Norbert and others as well. And although we have said that we would be ready and we would be preparing for such a situation, I do think it's quite honest that we all hoped and prayed that we wouldn't need to execute these plans. But here we are, and I'm very happy and pleased that we have already hit the ground running. We have built a robust system to respond quickly to this virus when it arises. That system has worked and served us well in the past, and it certainly gives me great comfort right now knowing that there are over 100 professionals who have moved so quickly to wrap their arms around this particular situation, and that the tracing and containment measures have immediately been enacted. But we're all concerned, and I understand that. And I just want to again remind Islanders that, for all Islanders, this is what we need to do. This is what we can continue to do today, is to follow the public health protocols that have been in place. As Dr. Morrison has continually said, wash your hands often, wear a mask, physically distance, stay at home if you're not feeling well, limit your contacts, download the COVID app to your smartphone. And most importantly, that if you are feeling any, and I mean any COVID symptoms, go get tested. For those who might think otherwise, you are not a burden to the system. Our system has the capability, it has the capacity. Testing only takes a few minutes. You don't need an appointment, and you don't need to be worried about getting a test. In fact, it's just the opposite. The most responsible thing that you can do for your family, for your friends, for your community, and for the province in general is to get tested if you have symptoms. I'd also like to just take a second to speak directly to our young Islanders. I know very much that you are a social group, and I know this virus has forced you to change many of your habits, change how you interact and who you interact with. And I know that that is maddening and it is frustrating and it feels as if you're being cheated of many of the things that make being a young Islander special. I know this. I have a 13 and a 16-year-old at home, and I've seen it firsthand how it's impacted them. And it's been hard. It's been hard on all of you. But you have been amazing through all this. You have adapted, you have changed, and you've tried so hard to make the best of this really crappy situation. And I'm proud of you all for doing that. And I just need to continue to ask you and all Islanders to dig just a little bit deeper. You're young and you're healthy and you're active, but you're not immune to this virus. If you have symptoms, Talk to your coach, talk to your teacher, talk to your parent, talk to anyone who's a leader to you. Tell them, go get tested. It's okay for you to miss a day at school or a practice or a game or a social event. And by getting tested, you're doing actually what you need to be doing, and that is to be responsible and to do what's best for your friends, your family, your community, your teammates, and for you. And finally, I would just say to all of those who play a leadership role in any way in the lives of young Islanders, be it teachers, parents, coaches, group leaders, have that conversation with those young people who look up to you. Remind them that it's okay to miss a game or a practice or a day at school or an event because they're not feeling well. Remind them of the importance, the responsibility they have, that if symptoms arise, to go get tested. That's what a strong leader does, and I encourage you to do that. I would just say in closing that we have started this journey together way back in March. And we've gotten to where we are today together because we have stayed close, we've worked together, and we've looked out for one another. And we have to continue to work as one team and one province to see our way through the end of this. So we will continue to keep Islanders informed over the next number of hours, and we will update you regularly as we learn more about this current situation. I would again remind Islanders to take some faith in the fact that we have a strong team working day and night to keep us safe. And the best thing that we can all do right now is to work with them, listen to them, do what we need to do to keep each other safe and look after one another. So with that, I would thank Dr. Morrison and thank Norbert, and we will be back in touch in the hours ahead. So thank you very much.